brain, but the actual the epileptic generalized seizure in the rest of the body is controlled with the medication. So the individual is very lying calmly in the bed, and they don't suffer any injuries. The most that they will experience after the ECT is done, maybe a headache, maybe a bit of muscle cramps. They will be temporary. Actually, what happens most of the time, within 15 minutes, the ECT procedure is done, and the patient will walk out of their stretcher and go back to the unit. So we actually saw some of the patients probably 2 hours after we finished the ECT, and they were back to normal day function.
Dr. McCole, ECT is not for everyone, is it?
No, it's not for everyone. It's mostly used, the biggest success rate we see is with severely depressed patients. That is where we see the most success. There is other indications, especially in people with schizophrenia, if they're agitated or catatonic, which means the illness actually makes them unable to move their body parts. Mm-hmm. And there's some indication for perhaps obsessive compulsive disorder, but definitely the major success we see is in major depression and suicidality. Actually, within a week, there's one study that we'll be talking about at the CME on Sunday, that I believe it's about 30% of people who were suicidal when they started, within a week that suicidality is gone, and within the course of the whole treatment, I believe it's up at 80%. The suicidal thoughts are completely gone in 80% of the people who were depressed and came in with suicidal thoughts. So that's a big number.
And that number is also seems to be very important to us with our small population and the ratio of successful suicides. And I just want to get back to Ram, because now you have, after the psychiatrists and so on will have done their thing, you are the one that speak with these clients. How do you gauge their success and their recuperation and their recovery?
Well, one of the things I have experienced working at the Homewood Health Centre in Canada, Kitchener-Waterloo, is to see that we've treated clients from all walks of life, from every profession you can think of. And the remarkable thing is, when they've lost that zeal for life, that zest for living, to see them going through ECT and then coming out of that and then engaging back in the community with the clients, first of all, and then in their family, and in going back to their professions, be it teachers, lawyers, doctors, whatever they were, getting engaged. I think that's remarkable. And part of that, I'd just like to say, Michael, is it's sad to see that in Guyana here, we have resources. We have our people, our most vulnerable, being left untreated. And here we have a viable, I think, very humane way of working with our client and to get them back into society. I think of the last visit when we were here, to see how our, as I said, the most vulnerable walking the streets and without any in a sense, lack of dignity in the way they've been treated, and to see that we have something that we can use for them. I think it's as Guyanese, as a former, being a Guyanese and living in Canada, if you can utilize the resources that's here and the skills that's available, it'd be wonderful.
We can do much more.
We can do a lot more.
All right. We've been talking about improving things at the National Psychiatric Hospital, and one of the aspects we want to bring in now is horticultural therapy. You've also worked with that, because we're putting up our Shade House project across there. How does that tie into overall recovery for mental illnesses, and how successful it is?
When we look at mental health or mental illness, we have to look at the whole person. It's not just one component of their lives. And if we're going to treat individuals, we have to treat every aspect of their lives. And part of the horticultural therapy in Canada that we've been using, it's great that you get the people to engage outdoors, engage with nature, that tactile, that involvement. And it's a way of giving them a sense of belonging, a sense of engagement. And I think it would be a great thing if we can utilize it here in Guyana. it'd be a wonderful thing to get involved. Because when you think about, you plant a seed, then it germinates, and then you see it grows, and you produce fruit. It's almost like that, a rebirth with mental illness, with ECT, having the treatment, and to see our client being engaged again in society. It's phenomenal.
So it's a good addition to the types of
I
services
think
we
it's a
offer.
wonderful addition, and it's not like we have to wait for winter
Yeah,
to subside. We have summer all year long,
all year long.
and wonderful to have that involvement here.
So thank you. Just joining us is Dr. Grinbury. He's the anesthesiologist. He puts you to sleep. And welcome, Ralphie.
Thank you.
And he's
Thank
just
you.
switched seat with Dr. McCall. Your thoughts on ECT? You've been working with mental health patients for a while, and the whole aspect of you being involved in this, knowing how the world sees mental health and how we maybe frown upon it. How has been your experience over the years, and more so what's been happening since you've come down to Guyana, especially today?
Well, I do all forms of anesthesia. I put people to sleep from everything from gallbladder operations to brain surgery. I put children to sleep, and I put asleep people for the psychiatrist to perform ECT, and that's a normal part of my life. I've been doing that for 30 years. To me, it's just an everyday occurrence. The anesthetic is not a particularly difficult anesthetic. I met with your anesthesia providers here. They're excellently trained, very capable people, very capable of giving the sort of anesthetic that's required for this procedure. And I see no reason why you can't successfully implement this sort of therapy. As for Guyana, the Ministry of Health and everyone we've met has been trying to help us as much as possible to get this project going, and we're very grateful for that. All the people we've met have been more than welcoming. We're having a great time.
Thank you, Ralph. Dr. Patel, what are some of maybe the side effects from ECT?
So I mentioned earlier some of the immediate side effects could include a temporary headache, maybe some muscle pain. We call that myalgia. Some people have that, some people don't. Usually it's temporary. Sometimes we'll use medication, painkillers, to make that less comfortable, or more comfortable, sorry. One of the other side effects is probably the most concerning side effects, which is memory loss. Now, don't want to get people all overly excited about that concern. Memory loss is usually around the time of the ECT treatment, around the time when the individual was quite depressed. So not really an important time in one's life to worry about that piece of memory. And in fact, depression causes memory problems as well, difficulty concentrating and focusing. So I want people to kind of look at weighing the risks and benefits in an appropriate way. There's probably less than 1% of people, so a very small number, that may have more persistent memory difficulties. But ECT does not cause any form of brain damage. It does not cause a dementia. It does not cause inability to learn new memories, so it is a side effect. But if you look at medications, even the medication paracetamol probably has 2 pages of side effects. So keep that in mind.
Oh, thank you. And as I said earlier, 30 minutes will just fly. But these are all part of the transformation that has taken place over the years when it comes to mental health. And at the National Psychiatric Hospital, we've introduced a regular supply of modern drugs that our clients are benefiting from. We will increase the staff complement, and that we are going to have a new psychiatrist and a psychologist join the staff across there. We have Dr. Maida, a doctor, and some able staff at the National Psychiatric Hospital. This will also help us to do outreaches across the region at our hospitals, so we'll be able to meet people at the community level to deal with issues regarding mental health. Time is going from us, but we want to remind you that on Sunday, the team of 20, the rest of the team is coming down tomorrow to join the 12 that are here, and we're going to have some powerful lectures or some CMEs at the boardroom of the Berbice Regional Health Authority. We're going to start at 9 a.m., and we wish to invite health workers, doctors, and private doctors, and even students at the University of Guyana who might be interested in being a part of this event. It's great. You will be listening to some of the finest in this field, and you'll get an opportunity to meet with them. Gentlemen, I'll probably give you 5 seconds for your parting thoughts, and we'll start with Ram.
I'd say that I was just thrilled with the staff, the nursing staff, and over both hospitals there, and give them the room to grow and let them fly.
I'd like to just thank the Berbice Health Authority. We came here a couple of days ago with a lot of challenges on our plate. Berbice Health Authority, including all the officials, yourself, Michael, the leadership at the both National Psychiatric Hospital as well as the New Amsterdam Hospital, helped us break those barriers down, and I'm so delighted today. It's probably been the highlight of my one past year to have this ECT program in this country.
Dr. Greenberry.
I'd just like to mention that in Canada, our mental health care system is not perfect. We're constantly transforming too. We have a vision for a goal in the future. We're aiming toward that vision. It's a high goal, and if you set a high goal, then you're going to make progress toward it. And the same thing here, we're trying to give ideas as to what sort of goal you might want to look for, and if you reach for a high goal, even getting halfway there is a big accomplishment.
Thank you very much. And with that, we'll have to part company here this evening. But I want to say thank you to the government and the people of Canada for once again supporting us in our program, especially in mental health. So thank you. Enjoy the rest of your stay, and we hope we'll have better food and good food for you for the rest of your stay. But thank you, viewers, for listening. We're sorry that we could not have taken calls tonight, but you can always reach us at the Berbice Regional Health Authority for any questions or query. But ECT is here to stay, and it is the way forward for mental health care in Guyana. It is a step forward, so thank you. Thank you for all your inputs. We're very grateful. Have a pleasant night and a wonderful weekend. Thank you for watching.